Recently, there have been reports of new cases of infections caused by Naegleria fowleri, commonly known as the brain-eating amoeba. In Kerala, India, a 14-year-old boy from Payyoli was diagnosed with primary amoebic meningoencephalitis, marking the fourth such case in the state since May 2024. This amoeba typically thrives in warm, freshwater environments and can cause a fatal brain infection if water containing the amoeba enters the body through the nose. Here's a brief history and key facts about Naegleria fowleri. Her discovery and initial cases. 1650. Naegleria fowleri was first identified by Dr. M. Fowler and Dr. R. F. Carter in Australia. They isolated the amoeba from the cerebrospinal fluid of patients who had died from meningitis. Or epidemiology, geographic distribution. Naegleria fowleri is found worldwide, particularly in warm freshwater environments such as lakes, rivers, and hot springs. It thrives in temperatures between 35 degrees and 46 degrees, 95 degrees and 150 degrees. Cases have been reported in North America, Australia, and Europe, among other regions. Infection rates. Despite its presence in many environments, infections are extremely rare. In the United States, the Centers for Disease Control and Prevention, CDC, reports fewer than 10 cases per year on average. Notable outbreaks and cases. 1970s. The first reported cases in the United States occurred, drawing attention to the dangers of the amoeba in warm, fresh water. 1980s, 1990s. Cases continued to be reported sporadically, with significant outbreaks in the United States and other countries. Public health efforts focused on educating people about the risks associated with warm freshwater activities. Tressier improved diagnostic techniques, and increased awareness led to better reporting and understanding of the disease, although the number of cases remained low. Recent cases. The amoeba continues to cause occasional fatalities. In 2013, a 4-year-old boy in Louisiana contracted the amoeba from a slip and slide, and in 2016, a young woman in South Carolina died after exposure to contaminated water during a church trip. Recurrent transmission and pathogenesis. Entry. The amoeba typically enters the body through the nose. When individuals swim or dive in warm freshwater, it then travels to the brain, causing PAM. Symptom. Initial symptoms include headache, fever, nausea, and vomiting, which can progress to stiff neck, confusion, seizures, and hallucinations. Bias prevention. Border precautions. To prevent infection, health authorities recommend avoiding swimming in warm, fresh water during high temperatures, using nose clips, and ensuring that pools and water systems are properly chlorinated. Treatment. Options are limited and often ineffective once symptoms appear. Early diagnosis and a combination of antifungal and antimicrobial drugs may improve survival rates, but the prognosis remains poor. The recent cases in Kerala, India serve as a reminder of the potential dangers associated with Naegleria fowleri. It is important to follow the recommended precautions and remain vigilant in warm, freshwater environments to minimize the risk of infection.